Hi, my name's Chelsea. I'll be performing a physical exam on you if that's alright.
Yes.
Alright, so I close the door, shut the curtain, wash my hands. I've already done a general survey noting his nutritional status and grooming. Done a mental exam noting his affect, eye contact, and mental status. Taken his vital signs including pain. Can you tell me your name?
Anthony Cave,
And do you know where you are?
78 Springdale Drive,
Good. And do you know today's date?
November 22nd, 2015.
Alright, and then I would look at his overall skin, look at the color, look for any lesions or irregularities. I would feel for temperature, texture, and moisture, and check for skin turgor. That's good. And I would go ahead and start with your head, and I'm just looking for any lumps or bumps in the symmetry of his head. Look for hair distribution. Go ahead and palpate for any bumps or nodules, and feel the texture of his hair. And then I would go ahead and look at his eyes, look at his eyebrows, eyelashes, all the parts of his eyes, and palpate his lacrimal sacs and glands. Good. I'm going to go ahead and check your pupils, so just look straight at me. Good. On the other side, keep looking at me. Okay, I want you to stare off into the distance. Good. And now follow my finger closer and focus on my finger. Good. I want you to follow my finger and look for eye movement. Good. And then I would inspect his ears, looking for any discoloration, bumps, or discharge, and go ahead and palpate them. And then I would move on and inspect his nose, looking for symmetry there, and go ahead and palpate and feel for symmetry or any bumps, as well as his sinuses. Good. I want you to close one nostril and breathe in and out. And the other side. Good. And then I'm going to go ahead and inspect his mouth. I would wash my hands and put on my gloves. I go ahead and inspect his lips first, and if you could open your mouth for me. Good. And look at his buccal mucosa, as well as his teeth and gums. Good. And lift your head up a little bit. Good. Looking at his hard and soft palate. Okay, and look down a little bit for me. Good. And stick your tongue out for me. Good. And say ah. Look at his tonsils and uvula. Okay. And stick your tongue out again for me. And palpate the tongue and feel for any bumps and nodules. Good. Alright. Sorry. I'm going to take my gloves off, wash my hands. I'm going to look at his overall face, again looking for symmetry. If you could smile for me with your teeth and frown. Good. Puff your cheeks out. And raise your eyebrows up and down. Good. And I'll check for some sensory in his face. If you could close your eyes. And his would be a little bit difficult with the beard. And just tell me if you feel something.
Yes. 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 Yes.
Alright. Again, more sensory. I'm going to keep your eyes closed. And I want you to tell me if you feel sharp or dull pain.
Dull. Dull. Sharp. Sharp. Dull. Sharp.
Good. And then if you could look up for me a little bit, I'm going to inspect his neck and just look at symmetry of the trachea, looking for any deviation, look at the thyroid gland, any enlargement, and go ahead and palpate that. And then I'll go ahead and palpate the thyroid gland. I want you to swallow some water for me when I say. So go ahead and look up to the right a little bit. Good. And then go ahead and swallow. Palpating the thyroid gland. Alright, good. I'm going to keep moving down the neck. And just feel his muscles here. Okay, I want you to shrug your shoulders for me. Good. And feel this cervical area of his spine for any irregularities. I want you to go ahead and turn your head back and forth. Good. And then I want you to go against me, push, and the other way. Good. And look up and then look down. Okay. And I want you to clench your jaw. Alright, and try to open your mouth for me. Good. Alright, and then I'll palpate all his lymph nodes. I'll start with the pre-auricle, the post-auricle, and go back to the occipital, and the tonsillar, submandibular, submantle, and then supraclavicle, infraclavicular, and then I want you to put your arms like this. I'm going to palpate your lymph nodes, the anterior, posterior, central, and the lateral. Good. Alright, now I'm going to go ahead and just look at his upper extremities again, looking at his skin, looking for any lesions or irregularities. I'm going to feel for his pulses here. Just relax your arms to your side for me. And feel for the brachial pulses and the radial. Good. I want to check his elbow joints. I want you to flex your elbow up and down like this for me, and while palpating his joint. Good. Now I want you to move against me, bring him up and back down. Good. I want you to put your hands out like this, and I want you to twist them back forward. Good. And now against me. And back against me. Now palpate his wrist. Go ahead and flex your wrist back and forth. And look at his hands and palpate all his finger joints. And look for clubbing, edema, and capillary refill. Good. And go ahead and squeeze my hands real tight. Good. If I could have you turn around, I'm going to look at his posterior chest. And again, inspecting the skin, looking for any discolorations or lesions. And then I will palpate, feeling for any nodules or bumps. And I would note respirations, rate and rhythm. Take a couple deep breaths for me. Good. And check for chest expansion, deep breath. Good. And then I will percuss. And check for CVA tenderness. Tell me if this hurts. Either side hurt?
No.
Okay. And then I'll go ahead and listen to his breath sounds. So just take a couple of deep breaths for me. I'll have you turn around and I'll do the same thing to the anterior chest, and again inspecting the skin color, looking for any discoloration or lesions. Go ahead and palpate, looking for any nodules, lumps, or bumps. Go ahead and take a deep breath for me, looking for chest expansion. And while it turned, I noticed the transverse versus AP diameter, 2 to 1. And then I will go ahead and percuss. And listen. And you take a couple deep breaths for me. And I'll inspect the heart area, looking for any pulsations there. And go ahead and palpate his apical pulse. And then I'll listen to his heart. And again with the bell sound. go ahead and lay down, and I'll take a look at your abdomen. Go ahead and give you a blanket. I would just inspect the abdomen, looking for symmetry, any lumps or hernias that are obvious. Again, still looking at his skin. And then next I will go ahead and auscultate. I'm going to feel for his inguinal lymph nodes that I skipped earlier, and then for his femoral pulses. And I'll percuss each quadrant and do light and deep palpation. And then we're going to do some range of motion exercises here with your lower extremities. Okay. So I would just inspect his lower extremities again, looking at his skin, feeling his muscle tone there. Okay. And I would feel his skin, and then feeling for any lumps or bumps or irregularities with the muscles. What I want you to do is I'm going to have you move your hips a little bit. So I want you to move your leg all the way up and then back. And then I want you to bend at the knee. Good. And then back up here. Good. And bring it towards you. Okay. And then straight out. Good. And I would feel the hip for any crepitus there in the joint. I want you to actually bend your knee up again and rotate your hip out towards me this way. Good. And then back inward. Good. And with your knee, I want you to bend it so it's straight up like this. Okay, go ahead against me. Good. And now bring it back down. Okay, and we're going to do the same thing on the other side. And you're going to go straight up. Okay, and bend at the knee. And bend up. Good. Now bring it down and push against me. And pull up. Good. And bring your hip outward toward me. And inward. Good. Okay. And then I would look at his ankles and feel it. Flex your feet that way towards you and then point outward and back. Good. Feeling his joints and then testing for strength and then push out again. Good. Now I want you to bend your feet like that and then outward. There you go. In and out. Good. I would also feel, that's good. Feel his toes, look at capillary refill, check his skin still, feel the joints in his toes. Check for pulses. Alright, and then I'm going to do some more sensory testing. So what I'm going to do is touch you, and I want you to tell me where you feel it and when you feel it. Okay?
Mm-hmm. Chest. Arm. Right arm.
Okay.
Right leg. Left foot.
Okay. We're going to do some more sensory testing. Tell me if you feel sharp or dull pain and where.
Dull in right arm.
Okay.
Sharp in left hand. Sharp in left thigh. Dull in right hand. Sharp in right leg.
Okay, good. We're also going to do a shin to toe test. So I want you to do is bend at the knee here. I want you to put your heel on your shin and I want you to bring it down that way to your toes. Okay?
Mm-hmm.
So go ahead and do it on both sides. Okay. Okay. All right. And if I could have you go ahead and you can stand up now. We're going to do some range of motion exercises here. And first I want to check his shoulders. What I want you to do is we're going to do forward all the way up. Good. And then bring it all the way back. Checking for range of motion. Now I want you to come toward me and just push against me. Good. And I want you to go up like this against me. Checking for strength. Good. You're going to do this to go this way. Good. And now come back down. And then go back up. Good. And then come back down. Good. Alright, and now if you want to turn around, I'm going to check his spine here. So I'll put you this way. And I'll just inspect his spine, look for any, look for symmetry, any deviation in the curve of his spine. Go ahead and palpate all his spinal processes. I want you to bend forward, and I'll look for his spine, look for any curvature there. And again, palpate, feeling the spinal processes. Okay. And now I want you to bend backwards. Good. And bend to your left. And bend to your right. Okay. And go ahead and rotate. Go like this. Twist, and then twist to the other side. Okay. And now I want to check your gait, so I'm going to have you just start right over here to your right. Good. And just turn toward me and just walk toward me regular. Good. And then I want you to walk that way with your heels to your toes. Good. And then walk toward me if you could walk on the back of your heels. Good. And then walk back that way on your tiptoes. Perfect. If you could stand over here for me. I'm going to do a Romberg test, so I want you to close your eyes and just stand just like that. I would check to see if he's swayed in one direction or the other, forwards or backwards, standing nearby. Okay, good. You can open your eyes for a second. And what I want you to do is hold your hands straight out, all the way up, and then close your eyes. And I would watch for arm swaying or him swaying back and forth, watching to see if his arms will droop down. Good. Okay, you can open your eyes. And then I want you to do, just put your arms out and put your fingers to your nose. Okay. And that's it. That completes the physical exam unless you have any other questions.
No.
Okay, thanks. I'm gonna wash my hands. I think that's everything that's about to be over.